The series of storms pounding the Southland can affect your mental health. Californians are more accustomed to warm, sunny weather. So when we get clouds and rain, it can trigger seasonal affective disorder, or SAD, a type of depression that occurs with the changing of seasons. We spoke with a doctor about the condition. What's actually going on in the body?
Yeah, so it's really multifactorial. And like you're referring to, when we have a yucky rainy day, kind of like today, people will often say it makes them sort of feel a little bit bad. One-off days, there's probably not a whole lot going on, except that we're just used to seeing the sun. And so it just feels a little bit different. But when it's more of a kind of ongoing, like the full season where you're getting less sunlight, shorter daylight hours, there can really be changes in your body's sort of phase cycle of the day. So almost like your sleep cycle, you also have a wake cycle as well. And so there can be a shift with that change in daylight hours, which can then impact some of the sort of feel-good chemicals that our body produces. And so with less of that sunlight and daytime, we actually produce less of those kind of positive feel-good chemicals like serotonin, and that can lead to the changes in mood.
And what symptoms should people kind of be aware of, either for themselves or their loved ones?
Sure. So for seasonal affective disorder, it's really a mood disorder. So we're looking for changes in mood, more so on the side of the depressive end of the spectrum. And so things like just feeling down, sad, blue. But depression can also look like irritability as well, especially in teens and younger kids. Sometimes they don't look as sad. They actually look more annoyed, frustrated, irritable. Those are the most common symptoms. But of course, there are other things that can happen, like changes in appetite, changes in sleep, and other changes in behavior that we might see.
If someone is experiencing these symptoms, what's your advice?
I think, there's a lot of ways to kind of go about it. Certainly, if it's really impacting your ability to go to school, go to work, do your daily activities of living, that's definitely a sign that it's, time to seek professional help.
And Dr. Zucker also suggests opening up curtains and windows to get some fresh air in and let the sunlight in, and going outside as often as you can.
Just don't